Hi, guys, you're live.
Hi, everyone. It is a pleasure to welcome you to the latest edition of the long running and highly successful program, The Futuristic Show, the Futuristic Friday. It's an excellent show organized by VOH Network. I thank VOH for the opportunity to moderate today's session. My name is Deepika Grandhi. I'm the business development head for Cleveland Clinic in India, and I also run a company called IMAS Healthcare. Now, this is the only company in India to provide a three-way video consultation between providers in India, their patients, and specialists from Cleveland Clinic. And without much delay, I would like to introduce you to our honorable speaker and our guest, Mr. Indranil Roy Chaudhary, who's the president of pathology at Medall Healthcare. Indranil's years of deep core expertise in the healthcare industry makes him a perfect person for us to time travel as we journey into the future. Indranil, welcome to the show. And it is an absolute honor to have you here today.
So thanks a ton, Deepika, for inviting me. It's real pleasure and honor to be here with you and with VOH and all our viewers today. Really looking forward to this discussion.
Great. Now that we have the introductions out of the way, let's dive into our topic for today, which is reimagining digital health for a COVID-19 world. Now, Indranil, I'm sure you'll agree that if there is one upside to this pandemic, it is that healthcare as an industry has recalibrated itself to meet the critical healthcare needs across the value chain. In fact, if you asked me, I would mark 2020 as a year where digital health technology has really reshaped in delivering healthcare. The massive adoption of telemedicine is only an example of how the healthcare industry has responded. We've used this as a weapon, to fight against COVID-19. Now, do you think, this was a great immediate response, to COVID as a crisis, but now do you think there are additional imperatives that companies should consider as we transition into the, post-peak period of COVID in terms of crisis resilience and as we, plan recovery?
Yeah, Deepika, as you rightly said, COVID had many learnings for all of us. Okay. Additional imperatives required? Definitely they are required. Before I go to what are the additional imperatives in my view, I would like to say why I feel they are required. First and foremost, we had never imagined that something like this COVID-19 pandemic may ever exist. None of us had
Right.
seen plague or something which had hit us some, 100 years back. So having seen this, we also know this can come back at any point of time. So we should be prepared. We should not be off guard like we were this time. So that is one of the reasons these additional imperatives are required. Furthermore, they will strengthen our business model. And most importantly, they will improve service delivery to the customers or the consumers who are actually what the industry exists for their benefit. So that is why they are required. Now, coming back to your core question, what are the additional imperatives that are required? First and foremost, I think in our country, though it had started off late, but by and large, most of the verticals in the industry were existing in isolation. A diagnostic company will probably do only diagnostic. A hospital used to do earlier only hospital services. A pharmaceutical company will do only making drugs and all. But now there's a need for offering a complete solution as a true healthcare partner to the consumer, because the consumer needs a one-stop solution. So the point I'm trying to make is every organization should now look into how they can integrate into the different space of healthcare. Of course, given their business model permits and their overall organizational strategy, but they should try and bring in teleconsultation, e-medicine supply, diagnostic test, everything under one roof. So that's a very important imperative that organization should look at. Second, organization should definitely look at in a very, very aggressive manner towards the wellness focus, because always prevention is better than cure. We all know the old saying. So wellness, when you really focus on the wellness, you are really ensuring that a lot of these chronic diseases are kept at bay or there is an early detection. So obviously the prognosis will be much, much better. So there's a need for the industry to look at the wellness focus. For the industry, also very, very important is to develop a business model which is very, very dependent on low fixed and high variable expenses, because this releases the pressure on the bottom line. And especially in a period like pandemic, when there is a lot of stress on the both top line and bottom line, such models which are low on fixed cost and very high on variable cost really helps, and it really do not lead to a lot of layoffs and job cuts, which many of the industry has seen. Even healthcare has also seen in some of the cases.
Right.
The other point which I would like to bring in here is the need for engagement models. It is not just doing, and I will speak from the diagnostic point of view, it is not only doing one test, but doing continuously improving and harping on improving the health condition of the patient.
Mm-hmm.
It is not doing the blood sugar test for a patient or a thyroid, but how can an organization help the patient to reduce the HbA1c or reduce the fasting blood sugar of the patient? That is what we need to think of, because that is going to lead to high customer retention. I think these are the few additional imperatives that industry should start looking at from the learnings of pandemic.
No, that's great. I think, you've highlighted the importance of, readiness for a pandemic. I'm sure I'm hoping this is our last pandemic that we see, but, we all know from a practical aspect, I keep hearing that, perhaps, this is going to be a world of, ongoing pandemics, and the more ready we are and the more prepared we are, the better it is for health outcomes. You mentioned integration of, healthcare ecosystem. Now, what challenges do you foresee, as we try to integrate, the different verticals across the healthcare system in India?
So if you really talk about challenges which can come in a way of integration, I think to me the biggest challenge is the people's mindset, the business leaders' mindset. There's no bigger challenge on that. Of course, having said that, there are few challenges in terms of the regulatory bodies, in few challenges in terms of the limited use of digital health and technology today in the healthcare space, which is definitely increasing. So I think if we decide to do it, we can surely do it. And there are many other countries who have already done it. Why not we? We are good enough to do that.
Sure. No, that's well said. So I like your suggestion of, the importance of mindset rather than focusing on, the logistics and the operations of how we go about it. Wellness and chronic disease management, you bring up a very good point. I think especially in India, we see there is, an ongoing increase of chronic disease, whether it is hypertension, cancer, and cardiac disease. And, I think we were just discussing offline the importance of executive health checkups. And I can't emphasize enough, the need for preventative medicine in India, because I still feel, we are here in this era of reacting to health conditions. We all are nervous to go to hospitals, right? We only go when we need to. So I think, there is definitely a need to change that and become more proactive about our health.
Yeah, Deepika, the point at what you said is, it's as simple as that. I look at it very simply. We all do not forget to take our vehicle for a annual servicing.
True, very true.
If we can do that for our vehicle, why can't we do that for ourselves?
Absolutely. That's
Then
something I think, that should resonate with the audience, with,
there's
with all of us.
so much value for money in that.
Right. Well, so what change, Indranil, do you see in the medtech space, when you compare the pre-COVID times to now? I mean, the one thing that strikes to me, as we speak is, the imperative role that pathology has played, and the role of, cardiac CT in diagnosing COVID. Now, that is obviously very clear, and it's the role is imperative. But what other changes do you see in the medtech space between then and now?
So I think other than those, what you mentioned, one of the biggest development has been approval of teleconsultation by the regulatory authorities.
Big one. That's a
a
big one.
huge one.
Yeah.
Already digital healthcare had started taking shape in our country, more so in the diagnostic space rather than the pharmaceutical. But COVID has really hastened the process, and teleconsultation approval has really helped it big time. So that's one. The other point that I will also mention is you say that what major shift we see coming in. So long, the pharmaceutical industry was behaving more as a conventional marketing method, like a face to face marketing model.
Hmm.
But post pandemic, almost all the large companies have started the digital marketing. Digital marketing was already, taking a big shape in diagnostics, hospital, and other healthcare space. So now we will see this becoming very, very predominant across the health space. Not only digital marketing, but availing the services digitally. You just mentioned that sometimes we think 5 times before we actually go to the hospital even
Hmm.
to get a health check. Most of the cases it is not required. We can do a teleconsultation. We can avail some of the home care facilities sitting at home, and we can even take order medicines online. You can even avail some nursing staff through online. So everything pretty much is available today. But what I see as important thing which is going to happen, or which must happen, industry and regulatory body jointly has to play an important role in ensuring that people can avail everything at an affordable cost. So we really foresee a lot of focus coming in from the government and from the regulatory bodies on healthcare, which the government has promised. So we are very, very hopeful that this will be again a major development which will really boost up the healthcare space.
No, that's good. Now, just talking about, affordability, I just wanted to spend time talking about insurance. Do you think we're going to see any paradigm shifts in the number of people insured in India? As of now, I still think the insurance industry is prematured in India or undercaptured. Do you think that's going to significantly change?
Well, we all hope that should, because that is going to that's going to open up a lot. That's going to increase affordability. That's going to open up so many other things. So we sincerely hope it should. Let's see, but we have been hoping it for the last before the pandemic as well. It didn't happen at that time. Hopefully, it should happen now.
Right. I agree. I think, it's imperative to have some kind of an insurance. I mean, all of us should. I mean, in the United States, it's very different, right? The proportion of insured is, much higher. And I hope to see that trend change in India as well. You absolutely brought up a good point around telemedicine and the acceptance and the role, obviously, of telemedicine as we've seen in this pandemic. But do you think moving forward, there's a lot of discussion around, what the hospital of the future should look like. We're talking about a lot of like hospitals, just handling the urgent care and, the surgical procedures, whereas everything else, we're almost talking about like a virtual hospital, virtual clinic that can be accessed at home. Do you see that as a reality in India?
Well, you see, Deepika, in some of my friends who are in the hospital industry, they are already talking about how the mindset changes. Today, in any of the major cities like Bombay, Delhi, Bangalore, Chennai, real estate prices are very, very, that's premium, right?
Hmm. Hmm.
So hospitals, rather than having very, very large OPDs, why can't they utilize that space for IPD and limit the OPD? Keep the OPD only to those things where the doctor really needs to see the patient face to face. Remaining all can happen through teleconsultation.
No, I mean, I agree. Just with Cleveland Clinic, just to give you the data, between March and April of this year, the number of outpatient virtual visits increased from a mere 2% before the pandemic hit to, if you can just take a guess, it's up to 75% or even more now, I guess. This data I'm quoting from, early this year. So I think I'm pretty confident that Indian healthcare organizations have seen the same phenomenal, acceptance of virtual visits. My concern would be in the policies and protocols that we are using with telemedicine to ensure we're not making errors, as we prescribe medications, and, following all the protocols that telemedicine guidelines, suggest, for healthcare providers. It cannot just be a mere Zoom call, a consultation. I hope, our providers in India are following the protocols, making sure, we have all the documentation in place to support that virtual visit. And we are also ensuring that the type of the visit is appropriate, right? I mean, not all consultations can go through a virtual visit. I hope, I know there are guidelines in place, but I hope there's also a measuring of compliance, with regards to the use of telemedicine appropriately.
That's so very critical, Deepika, because, and for that's why I said that the regulatory body as well as the industry will have to join hand and play a very, very important role. See, regulatory body can lay down the rules, but compliance ultimately depends on the industry. I mean, so
True.
that's where it's going to be very, very important and very, very critical. I'm sure as a country, we are improving significantly and will continue to improve and will surely do a good job. We will sincerely hope that.
Absolutely. I think as long as, the providers, the patients have the right intent and how we use, technology, it should be a necessity and hopefully not an evil.
Absolutely, absolutely.
And then, I think as we transition out of this pandemic, where do you see the healthcare industry, going forward? Do you think with the success that we've had with, telemedicine and some of the in the digital health space, do you think we're going to leapfrog ahead, make more progress in terms of AI innovation? What shifts do you see happening as we move forward?
So first and foremost, as I mentioned, I see a lot of shift happening from illness to wellness. That is
Mhm.
a very, very attractive and sweet space. So that will is one. Second, the use of artificial intelligence, both in terms of radiology as well as pathology, that is going to play a major role. That's the second thing that I see very clearly. Third, I see a lot of improvement and innovation in the way service delivery happens to the ultimate consumer.
Mhm.
So, contactless services, uh, a lot of use of wallets and e-payments, uh, reports going online rather than everything being delivered physically. All these are very, very important changes that industry is looking at, as well as industry is looking at how we project to the people.
Mhm.
So a lot of digital promotion, that's also important. While we look at all these important things that might take place and or that will take place, I really, as a industry person, and I'm sure all my colleagues in the industry, we sincerely hope, specifically for the diagnostic industry, that the government and the regulatory bodies play a very, very critical role, and they must. It's high time they should. See, I'll tell you what. Today, in unfortunately in the diagnostic industry, there's hardly any entry barrier.
Right.
Okay, so it's important to bring in those entry barriers. It's important to lay down rules in terms of quality control, lay down rules in terms of ethical promotion to the clinicians, as well as to lay down rules in terms of usage of techniques and the ways tests are being performed. Let's not forget that almost 70% cases, the decision by a clinician to use a treatment protocol depends on the result of the diagnostic test. So this data is good enough to stress the need of accuracy of reports that is required today. But unfortunately, in our country, there is no standard method laid down by the regulatory bodies. Like we have in pharmaceuticals, there's Indian pharmacopoeia. So whenever you have to launch a new drug, it is always compared against a standard.
Right.
There's nothing of that sort in diagnostics.
No, I
And that,
agree. I mean, when I was working back in Cleveland Clinic, we were part of a project. It reminds me where we were trying to implement appropriate use criteria for the use of testing. And, organizations such as American College of Radiology, have very stringent criteria in place for when you actually ask for a procedure. And we take those documentation guidelines very seriously, and we have audits, we have quality check controls to make sure, for every imaging test that's written, there is criteria in place and that it's documented. So I agree with you. I think we have a long way when it comes to those criteria in place. Government and the regulatory bodies have a huge role in making sure that this is in place, so physicians and providers are not uh, rewarded for volumes rather than the value to the patient.
That's exactly the point I'm making when I'm trying to say that the need of ethical marketing, ethical promotion should happen in this
Absolutely, I think
case.
that's very, very much required in India. I like your responses. Now, in terms of you mentioned artificial intelligence. Um, we've had some seminars, conferences, with Cleveland Clinic, where the discussion was around AI, and the question was, is AI a hype, a hope, or a reality? Where are we in India with regards to AI?
In my view, it's definitely not a hype. It's a mixture between hope and reality, and I will bring in a third factor in that. I will bring in, no matter how much AI comes in and all, let's always understand it is a man sitting in front of a machine at the end of the day, and that man taking a call is going to be critical. So what AI will do? AI will basically have, and the computer's memory, some of the pictures, some of the images, and what have been the diagnosis earlier. With that, it will correlate. But there are so many other things important which is linked to it. Whether it is AI in radiology, whether it is AI in pathology, whatever you talk about, clinical correlation is so very important,
Absolutely.
wherein the doctor who is signing the report needs to have a discussion with the clinician whether the findings of the report, whether pathology or radiology, are in correlation with the clinical findings of the doctor.
Great. Now, so what, in other words, I think just to rephrase what you said, we need natural intelligence. When it combined with artificial intelligence, we might get optimal results, but natural intelligence will never be replaced by
It
AI.
can never be. It can never be. Let's understand, at the end of the day, natural intelligence is only going to create artificial intelligence.
Yeah, I mean, I think it's going to create knowledge, but whether we have understanding of how to use that knowledge,
And
you have to
interpretation.
rely on pathologists
And
and
interpretation
doctors.
as per that particular case.
Right, right. And my other question is regarding, when you said medical records going online, and I'll make this quick. I know, we have just 5 minutes left. The role of EMR, electronic medical record, and importance of capturing structured data. We still see patients and, hospitals in India that are surviving on paper. And I think we have a long way to go. What are your thoughts as we transition out of this
There's
pandemic?
no second thought in what you are saying. We should have a central registry. I mean, those are ideal things we talk about. But of course, we should have all those ideal things. But to me, the basic fundamental today is basic data captured and protected in the right manner. The patient's privacy has to be protected in the right manner as per the laid down guidelines. Those are some things that many organizations, I'm afraid, are not following. So those have to be done. And when in a large country like us, we have everything integrated. I mean, data is gold. We have gold mine of data which can be so very useful for the betterment of everyone. But yes,
True,
that
true.
important thing has to be there, so that everything has to be linked up and properly structured as per the government guidelines.
Right. No, I agree. I think just like we have a patient consent for a procedure, we need to have that patient consent for the use of their data going forward. Agreed. Now, I think we're going to switch gears here. We've seen outstanding leaders in our country, including, our Prime Minister Narendra Modi ji, who've led us, in such a wonderful way during this crisis. Our mortality related to COVID is one of the fewest, compared to the population we have, or one of the lowest. Now, what would your mantra be, for change leaders of tomorrow?
Well, when you talk about change leaders of tomorrow, very interesting. People are always resistant to change. But as they say, change is the only constant thing in the world. Well,
Exactly.
to respond to what you say, I would say past experience is important, but we need to strike a balance. We should not let past experience occupy our mind so much. We must evaluate even the craziest of the ideas. I mean, that's what I feel, that as an industry leader, we should be having a very, very open mind, ready to evaluate craziest of ideas and not shut down any ideas. That's what I
Sure.
think is going to be important.
So creative thinking and thinking out of the box. Great. I've spent very few minutes from you. You're such a visionary, and as a thought leader, I'm sure you inspire so many. What keeps you inspired? And you get going. Get going in the morning when you wake up.
I think it's so very common for many people. I'm not nothing great. But I always believe in, I'm always at school, ready to learn.
So learning is permanent, phenomenal. You're saying, in other
Absolutely,
words.
absolutely, absolutely.
Well, thank you for those pearls of wisdom. I think I'm sure the audience will agree that change is constant, and as long as we continue to learn, success is bound to happen. My closing question: what gap in healthcare space do you think content platforms and healthcare advocacy organizations such as Voice of Healthcare offer to the society in India today?
Well, I think a very important question. Voice of Healthcare, these organizations, they can really do wonders. Today, the need is to reach out to the masses. The need is to increase awareness and educate the people. I think so. A platform like Voice of Healthcare can do wonders in that, through all the broadcasts that they do. That's one. The second thing is, which is very again important, especially more so for a diagnostic space where the industry is not very cohesive and you have only 7 8 uh, organized players. It can make industry leaders join hands and address common issues for the betterment of the people. So that's the second thing. And also, I think it will definitely help industry to stay in touch with consumers, to understand what is the changing need and how can industry continuously adapt to that need to provide better customer service. I think though these are the important roles which I feel organization can Voice of Healthcare can play, and they are playing. And I'm really thankful to such organizations, who are doing a splendid job in our country.
Yeah, I agree with you. I think the need of the hour today is to have unbiased organizations, that are neutral parties that are working with the government, with the healthcare players, and watching out for the consumers and what's best for the consumers. It reminds me, there are agencies such as the Leapfrog and Health Grades in the United States, that are public-facing agencies, which not only fulfill the responsibilities of awareness and education, but they also capture patient experience data. I mean, this is it's taken off so well in the United States, where patients can very transparently provide their feedback as to what their experience was with the hospital and so on. And I think this trend will continue to be seen in India as well, given age of this country is so young. Patients of the future are going to be younger patients. They're very tech savvy and very focused on customer service. So I think the role of VOH will continue to grow, and I'm very thankful for all the services that VOH offers. I want to thank you, Indranil, for your time today. It was such an enlightening session, although it was a short 30-minute session. I hope we continue this dialogue offline as we're connected. And I would like to thank our audience, our wonderful audience, for their time today in participating on a Friday evening with us. And thank you for the team at VOH, Naveen, Pinky, and Kushbu, for making this session happen. So a very happy Friday and a very good evening.
And thank you also, Deepika, and the entire team at VOH, and wish you all a very happy weekend. Thank you. Thank you. And stay safe, everyone. Thank you.
Stay safe. Exactly. Bye-bye.